I'm here today with my patient Christina. She is 4 weeks status post from a total knee replacement. She came in with some knee pains. She has some limited range of motion. As you can see, her affected side is stuck at, supposed to be 12 degrees. She can only go from 12 to 108, I believe it was, or no, 118 or something. But it is limited range. So what I'm gonna go ahead and do is I'm gonna go ahead and first, since it is still within the acute phase, I'm gonna just kind of do some joint mobilizations to help with knee flexion and extension. So first, in order to increase knee flexion, I'm gonna go ahead and do an anterior to posterior joint mobilization on her knee. So what I'm gonna do with that is I'm gonna go ahead and take her to her end range, and of course within without pain is what we're trying to go for. We're trying to avoid pain as much as possible, especially since it's still within acute phase. So what I'm going to ask her to do is to please scoot over as much as you can without falling off. Awesome. Okay, so what I'm going to do is I'm going to go ahead and wrap my hands just right around the area. And actually, before we start, just to stabilize her hips, I'm going to go ahead and add a folded pillow under the other knee. That way it's just rested and neutral. Does that feel okay?
Yes.
Okay. Alright, so what I'm going to do is I'm going to go ahead and do some anterior glides. Is that okay?
Yep.
Okay. So that's for knee flexion. And if I want to increase her knee extension, I'm going to do a posterior to anterior joint knee glide. So I'm just going to go ahead and just pull out, just like so. Another thing that I can mobilize is her patella. And I'm going to go ahead and do that by, we can actually go ahead. I want her at a relaxed position as much as she can, or as much extension as she can, but since she can't go for the full range, we're going to take her to the, actually no, we're going to take her to her end as much as she can, as extended as she can. So to increase knee extension, what I'm going to do is I'm going to go ahead and use the web of my hand and do some superior patellar glides. And I'm just going to push that patella superiorly. And for knee flexion, I'm going to do the opposite by pushing the patella down, inferior glide.